I am Dr. Lamin Jaiteh, a Gambian by nationality and a general surgeon working at the Edward Francis Small Teaching Hospital in Banjul, the Gambia. I am a beneficiary and have been nominated by the First Lady's Office of the Republic of the Gambia for a one-year fellowship by the Merck Foundation in surgical oncology. Oncological care in the Gambia, like most parts of Africa, faces a number of challenges. And key amongst these challenges is actually personnel or human resources when it comes to oncology. There are very few oncologists in my country. Actually, there has been only one trained oncologist by this same fellowship program who is currently in the country, and myself being the second person who has had formal training in surgical oncology. And this is something that has affected the outcomes of oncological care in our countries. So that's both in the rural and the urban areas. So one of the ways of actually trying to mitigate these challenges when it comes to oncological care is actually adopting a team-based approach to oncological care. Gone are the days when cancer patients are treated in isolation by individual doctors. Evidence has shown that actually the best outcomes for patients who have cancer is actually having a multidisciplinary approach. And this fellowship has provided an opportunity into how a multidisciplinary approach in cancer care should be taken and how that improves overall patient survival. To help improve oncological care in my country would be human resources, as mentioned. So having a critical mass or enough people who are trained in oncology, not just surgical oncology, but medical oncology and palliative care and in nursing oncology would be the first step in order for us to be able to have enough people who will be able to care for these patients. The other step would obviously be able to come up with protocols and getting the right material resources in order for us to be able to care for these patients. Prior to my coming for this fellowship program, I had basic oncological training during my residency. But once I came to this program, I realized that there was a lot more to learn in terms of oncological care, not just in the multidisciplinary approach, but in my field of surgical oncology itself. When it came to the management of patients, when it came to protocols that needed to be adopted, and when it came to the techniques surgically that were necessary in order to be able to improve patient outcomes. So these are things that were quite critical and I have been able to benefit from during this training. To be quite honest, my expectations, I wouldn't say I had any particular expectations. I knew I was coming for a fellowship program and it was basically to get training in a field that I felt I had a good level of knowledge. But once I got here, I realized that there was a lot more to oncology than just my field of interest, which was surgical oncology. I was able to realize how a system in which you have comprehensive cancer care should work. And this is something that I feel I would be able to apply once I get back to my country in order to make sure that the patients who are faced with cancer are getting the right type of treatment within the Gambia. The exposure I had here was quite vast. Despite the duration of the training, I was exposed to, within my own field of surgical oncology, different techniques. That is minimally invasive techniques of most of the oncological surgeries or cancer surgeries that were done minimally invasively, meaning that these are surgeries that were done without having to actually open up the body, and this allowed patients to go back home quickly without much pain and without having to stay away from their families. The other levels or parts of exposure that I had was in the areas of medical oncology, where I was able to see how chemotherapy drugs were actually administered, how palliative care was done for patients who could not benefit from curative care, but were able to have the best supportive care possible in order to be able to prolong their life and make their stay with their families a lot more easier. I also had the opportunity to see what preventative oncology was about, meaning that being able to go out towards the population and care for patients who either are living with cancer or patients who may be living with cancer without knowing it. So in a sense, helping to perform what's called screening exercises for potential patients. This training provides a good foundation and a good knowledge base for me to be able to participate in the initiation of a cancer unit in my country. My advice to anybody who's thinking of coming for a fellowship is that this experience for me has been one that is very enriching, both on the academic and non-academic side of things. I have had exposure to a vast array of areas within my area of specialty that I did not expect to have. And also I had cultural immersion within the Indian subcontinent, wherein there was a diversity and there was a feeling of being welcomed, sort of home away from home. And this is something that I feel contributed to the pleasant experience that I had within my short stay and training here in India. My advice to anybody who would want to come on this training is that it's something that would be a transformation for your career and for your outlook when it comes to cancer care within your country. I would like to show gratitude for all those who contributed to making this fellowship possible. That starts with the First Lady's Office of the Republic of the Gambia, the Merck Foundation, and also the host institution, that is the Bibara Cancer Institute in Guwahati, India.